Hi, I'm Rabbi Hammer, and this is Simply Mental Health. Remember, please, to subscribe below, and feel free to send me your comments. I look forward to hearing from you and responding to them accordingly. Last week I discussed what is the definition of mental health, and conversely, the definition of mental illness. Well, as follows, this week I'd like to discuss with you a term or a word that is thrown around popularly, that we're all very familiar with, but that's important for us to define, to respect, and to understand. And it's called therapy. Therapy is a means of expressing. It is a means of releasing one's emotions in a positive, constructive way. And ultimately, therapy really teaches a person who is suffering from mental illness and mental challenges coping skills to deal with the world around them. Therapy exhibits itself in many different ways. There are many different types of therapies. There is animal therapy, whereby a person will interact with animals and find that a positive means of expression. There is music therapy, either through listening to music, appreciating music, or playing a musical instrument, again, being a release of one's emotions in a positive way. There is drama therapy or psychodrama. Through dramatic interaction or role-playing, a person learns again to get in touch with their emotions and to release and again avoid allowing those emotions to fester and ultimately, God forbid, arriving at perhaps an explosion. And finally, of course, there is what we would call psychotherapy, classic talking therapy, communication, dialogue, engaging with someone else, with the therapist, and learning how to discuss in a positive and healthy way. Research has demonstrated that the benefits of therapy far surpass in long term the benefits of medication. And that is why it is extremely important that it be implemented and embraced by those who are suffering from mental illness and mental challenges. Therapy ultimately teaches a skill set. How can a person approach the day? How can a person approach their lives? How can they ease the pain, the anxiety, the various feelings that fester inside of them so that they are able to cope with the day-to-day functions that perhaps a different person might find easy enough? For this person, through the therapy, they learn how to be able to cope with those and to move through the day in a very productive and positive fashion. In order for therapy to work, there needs to be two things. Number one, there needs to be the consent of the patient and, of course, the consent of the therapist. If a patient goes to therapy and they don't want to be there, it will prove to be highly ineffective. It will not work. And the second component that is necessary in order for therapy to be successful is chemistry. A therapist and the patient have to form an understanding, a dialogue, a consideration, a sensitivity. There has to be empathy there, one for the other. That's chemistry. And when there is chemistry, it can be highly effective. When there is no chemistry, it can prove to be completely, once again, ineffective. And so these two components are very important for us to bear in mind. When people come to me and say to me, you have to send this person to this therapist. They are the best therapist in the country. I always say to them, for whom? It really depends. What's good for the goose is not necessarily good for the gander. This therapist is excellent for this person, but it might not necessarily, or he or she might not necessarily resonate with another person. And so the chemistry has to be there. And I leave you with this final point, and that's an important one to remember. Let us remember that the only thing that is worse than not getting therapy is going to what we would call bad therapy or ineffective therapy. It's important for us to remember this because when someone takes the drive or the initiative to go to therapy, they want to see that there's a benefit to it. They want to have a positive outcome. Now, it takes time and patience, but nonetheless, slowly but surely, that person should see that there is consequently something positive coming out of it, and that they're starting to feel better with themselves, and at the very least, learning coping skills and learning how to emote and relate and engage with others around them in a positive way. I hope and pray that this has been helpful for all of you, and that indeed we can implement these lessons, these instructions, these guidelines for the people around us and help them cope with the world around them. I thank you for listening. I remind you once again to subscribe below, and I look forward to hearing from you. Have a good and healthy day.